We had an extensive experience with the old mid-cab procedure years ago, we certainly were interested in another technique that will allow us the opportunity to provide excellent surgical revascularization for patients in a sternal sparing procedure. And so when we learned about the McGinn technique, we felt that it was important to add this to our armamentarium for advanced coronary revascularization. Went to see Dr. McGinn in Staten Island after learning about the procedure, through observing his technique and then subsequent discussions with him, we're able to go on and perform this procedure in our hospital. And with that peer-to-peer training, felt much more confident in offering this technique for our patients. I would say this procedure is an advanced coronary technique, and it requires surgeons that are experienced and skilled at standard transsternal beating heart surgery. Right now, the current rate of adoption of standard transsternal techniques is perhaps 1 in every 4 patients. So there are a minority of surgeons around the country that perform beating heart surgery routinely. That limits the number of potential surgeons that would be in which training for this procedure would be applicable. And I think that this really requires an extensive experience to begin. So this may not be a technique that will ever be universally applicable. So I think we feel strongly that this is an important part of our armamentarium for advanced coronary revascularization. In particular, we've used it in really a high-end application in conjunction with our cardiology colleagues for patients that require, that have complex comorbidities, and we can offer them the gold standard for revascularizing their anterior wall, which is an internal mammary artery graft to their left anterior ascending coronary. How we treat their other coronaries is still a bit controversial, and in our institution we'll often use this operation in conjunction with stents to other arteries in a true hybrid type procedure to allow them a shorter hospital stay and yet the best of both worlds for revascularization. Again, that's very controversial, I would say, but it clearly has allowed us to think outside the box a bit with regard to complex coronary patients. My cardiologists will often be in the operating room understanding what we're doing with minimally invasive techniques, and they will often see patients who, by their characteristics, unique characteristics or comorbidities, are good candidates for this sort of an operation, and will call me specifically saying, I think this patient needs a minimally invasive approach, and what you do would be appropriate for them, and we'll go take the discussion from there.